Today, we're focusing on some of the most exciting advances in immunology. These developments revolve around genetic engineering, stem cell research, and cutting-edge immunotherapy treatments that are changing the way we think about disease and patient care. Let's start with genetic engineering. One of the most remarkable technologies in modern science is recombinant DNA technology. This has two major facets. The first allows scientists to take genes from one type of organism and combine them with genes from another. When this happens, we can create cells or microorganisms that are able to manufacture useful products like proteins, monokines, and lymphokines. These substances can alter or enhance the function of the immune system, essentially giving it tools it wouldn't otherwise have. The second facet of recombinant DNA technology is gene therapy. This is where things get even more fascinating. If a person has a gene that's abnormal or missing altogether, researchers are experimenting with ways to restore normal function. Imagine inserting a healthy recombinant gene into a virus particle. Once inside the body, that virus splices its genetic material, automatically inserting the missing gene and, in theory, correcting the defect. This is still under extensive research, but the promise of restoring function at the genetic level is huge. Now let's move to stem cells. These cells are special because they can both self-renew and differentiate, meaning they can continually replenish the body's entire supply of red blood cells and white blood cells. Some stem cells, called totipotent cells, have the greatest capacity for renewal and differentiation. Embryonic stem cells, which are described as pluripotent, can give rise to many different cell types and form tissues. Research has shown that stem cells can actually restore an immune system that's been destroyed. In fact, stem cell transplantation has already been used in humans with severe immune dysfunction, such as severe combined immunodeficiency. Beyond that, clinical trials are underway using stem cells in conditions like lupus, rheumatoid arthritis, scleroderma, and multiple sclerosis. Research with embryonic stem cells has opened doors in developmental biology, gene therapy, tissue engineering, and new treatments for a wide variety of diseases. Finally, let's talk about cancer and immunotherapy. We've long known that the immune system plays a role in fighting off cancer, but cancer cells are clever. They develop ways to hide from or shut down the immune system. Recent advances in immunology have led to therapies designed to boost the body's natural anti-tumor activity and block the escape pathways that cancers rely on. These include monoclonal antibodies, cancer vaccines, immune adjuvants, checkpoint inhibitors, CAR T-cell therapy, and cytokines. Each of these treatments works in different ways, but the goal is the same: to stimulate the patient's own immune system so it mounts its own defense against the malignancy. These therapies have truly revolutionized cancer treatment, offering new hope in diseases that were once considered untreatable. So in summary, the field of immunology is advancing rapidly. Recombinant DNA technology is rewriting the rules of genetic repair. Stem cell research is unlocking the body's ability to rebuild its own immune system. And immunotherapy is transforming how we fight cancer. For nurses, understanding these advances is more than an academic exercise. It's about appreciating the tools that may be available to your patients now or in the very near future. Tools that can alter the course of disease and change lives.